Welcome to the First Aid Frenzy. In this section, we are going to discuss about the pigment disorders of skin. But firstly, we'll discuss about the melanin, the pigment formed from amino acid tyrosine, and it is synthesized in melanocytes, which are the specialized secretory cells derived from neural crest cells. Melanocytes present in basal layers of epidermis to synthesize melanin in melanosomes, which are then transferred to keratinocytes. The next disorder is freckles, which are actually the small brown flat macules which can get darken after prolonged sun exposure. In freckles, only the amount of melanin is increased, but the number or density of melanocytes remain normal. These cells actually start forming excessive amounts of melanin. Next is the genetic disorder named as oculocutaneous albinism. It is an autosomal recessive disorder in which melanin synthesis is reduced or completely absent. The next disorder, melasma, is acquired hyperpigmentation associated with pregnancy, so-called as mask of pregnancy. Here it ends. Thank you for watching the video. See you all in the next one.